We'll be conducting an assessment of the vascular system. We're going to start with the arms. And the first step is to inspect the arms. If you could hold your arms out for me, sir, and inspect for size and dimension and make sure they are equal. Occasionally you will have a little bit larger in your dominant side. That is considered normal. And then we will inspect for color. So compare color from side to side, and they should be approximately equal, although you might have the left arm being a little tanner than the right, especially in the summer. Next we're going to assess for color. You can relax and take one arm first, and with the dorsum of your hand we're going to just assess for color, fingertips, hands, forearms, and then upper arms. And your temperature should be about equal in all areas. And then you would do the other hand and arm after that. Next, assess for clubbing. Look at the fingertips and assess for clubbing. You may have to hold them up parallel like this in order to see the nail angle. And do both sides. Very good. Have no clubbing. And now we're going to assess for capillary refill. Take one of the fingers, gently depress the nail bed. It should blanch, release, and count the number of seconds. And then the other hand as well. Blanch, release, and count seconds until you get capillary refill. Next, we're going to check pulses. I'm going to start with radial. And it's often a good idea to do both pulses bilaterally to compare. Then we'll do ulnar. Ulnar is kind of hard to get. I usually raise the hand and assess the ulnar. And then we'll do the brachials. Can you straighten your arm? Brachials are usually just to the ulnar side of midline. And then the other. The next thing we're going to do is palpate for epitrochlear nodes. And if you can straighten just a little bit. The epitrochlear nodes are located in the little groove between the biceps and the triceps. Can you externally, there we go. Right here, biceps, triceps, little groove right here, so you would palpate right in this area here. And you would do that bilaterally as well. And then the final part of the arm assessment is the Allen's test. And for the Allen's test, squeeze your hand very tightly and simultaneously occlude both the ulnar and the radial arteries, and you can relax. And straighten your fingers for me. And the hand should be blanched. If you release the ulnar artery, the hand should pink up within a few seconds. That indicates that you have a competent patent ulnar artery. And that concludes our assessment for the arms. Now we're going to assess the legs. If you could lie down for me. There we go. So in assessing the legs, first we'll do our inspection. Inspect color and size on both sides. Legs should be equal in dimension and diameter. Assess for color, and then assess for hair distribution. Someone who has normal arterial competency should have hair on the legs and a little bit of hair on the toes. Absence of hair may indicate an arterial occlusion. So assess for level of hair distribution. Assess for ulcers or skin lesions, both sides, all the way up, bilaterally. A common mistake, especially if your patient is in bed, is make sure that you assess under the heel as well. That area is often commonly missed. Also assess for edema. Edema can either be pedal or pretibial. Press down and assess whether you have any edema and whether it's pitting, it retains the depression, or whether it immediately resolves. And you would do that on both sides. Next, temperature. Dorsum of the hand. Start at the toes, the feet, pretibial, and then all the way up. Look for changes in temperature, and that may tell you where you have arterial insufficiency at some point. And of course, you will do that bilateral. Next, we are going to assess the inguinal region. Put your arms down for the side for me. And we're going to palpate inguinal nodes. Inguinal nodes are in the crease between the abdomen and the leg, so you would palpate inguinal nodes on both sides. We would then auscultate femoral artery. Take your stethoscope and auscultate femoral artery. Once again, using your diaphragm and your bell. And you would do that bilaterally. And then assess your femoral pulse. Always auscultate before palpating. So you would palpate your femoral pulse bilaterally as well. We'll next check our distal pulses. Our three classic leg pulses are the dorsalis pedis. This is often variable, so you may have to search around for it slightly. The other thing is don't use a great deal of pressure. It might occlude the pulse. The second is the posterior tibialis, which is located on the medial side of the leg between the Achilles tendon and the medial malleolus. Take your two fingers and palpate for your dorsalis pedis pulse. And once again, do that bilaterally. The third one is the most difficult, and that's the popliteal pulse. Very common way to do it is to raise the leg very slightly, place both hands around the knee, and palpate behind the knee surface. This is a difficult pulse to feel, so you may not palpate it successfully at times. That concludes our assessment of pulses. What we're going to do now is assess for venous and arterial abnormalities. First one we're going to look at is varicose veins. If you could stand up for me, please. And you would look at the, kind of hold that up for me, there we go. And you would assess the legs. Classically, they occur on the inner side, but can occur at any area on the leg. If you do see varicose veins, one of the assessments that we do is a manual compression test. Compress the varicose vein at the bottom and about 6 to 8 inches above, and compress at the bottom. If the veins in the varicose vein are incompetent, you will feel that wave of compression in your upper hand. So as you compress at the lower end of the vein, you will feel that wave transmitted up to your upper hand. So that's an indication that you have incompetent valves in the varicose vein. Our next test is called the Trendelenburg test. If you could have a seat again, please. And the if you could lie down, I'm sorry. Trendelenburg test. Raise the leg for about a minute. And then place a tourniquet on the leg. And then ask the patient to stand up. Can you stand up for me? In a normally competent venous system, you'd have very slow venous filling. If you have an incompetent venous system, then when you release the tourniquet, the vein should fill up very rapidly. That's an indication that they're being filled up through incompetent conduction. Okay, if you can have a seat back down. One more test to go. The next test is a test for arterial insufficiency. In this one, raise your legs and pump your feet back and forth for a few minutes. Do this for about a minute. Okay, that should drain the color and the arterial filling in the leg. And if you would stand up or sit over the edge of the bed, please. And now observe the leg for color change. In a normally competent, with normally patent arteries, the leg should return to its pink condition within a few seconds. Prolonged time to recolor or reperfuse may indicate arterial occlusion. And if you could lie down one more time. And then one final test is for deep vein thrombosis, which is the Homan's test. Slightly bend the leg, support under the calf, and dorsiflect the foot. Typically with Homan's, if you get pain in the back of the calf, that may be an indication that you have deep vein thrombosis or thrombophlebitis. And that concludes our vascular assessment.